We've got good news about one of your most important assets, your butt. Because of a landmark research study, medical care for people with HIV has changed to help prevent anal cancer or catch it early. Anal cancer can be tough to talk about, but it's a big deal. Anal cancer is cancer of the anal skin. The anus is at the end of the digestive system, below the colon and rectum. Anal cancer is rare, and most cases happen in women. However, people with HIV are about 19 times more likely to develop anal cancer than the general population. Anal cancer develops from anal precancer, called anal high-grade squamous intraepithelial lesions, or HSIL for short. HSIL is abnormal skin growth in the anus. Both anal HSIL and anal cancer are caused by the human papillomavirus, or HPV. Anal HSIL is not cancer, usually doesn't have symptoms, and most often doesn't progress to anal cancer. However, sometimes anal HSIL can worsen to anal cancer. Anal cancer treatment, chemotherapy, and radiation therapy can cause serious and lasting side effects even when the treatment is successful. Treatment isn't always successful, and anal cancer can be fatal. Preventing anal cancer or catching it early is the best way to avoid these outcomes. Reducing the risk of anal cancer is important to many people and their medical providers. That's why, with help from community and patient advisors, researchers at the AIDS Malignancy Consortium and National Cancer Institute launched the historic ANCHOR study in 2014. This was the largest study ever performed to determine if anal HSIL treatment prevents anal cancer. More than 10,000 brave people with HIV volunteered to be monitored or treated for anal HSIL. In this study, providers looked for anal HSIL with an exam called high-resolution anoscopy, or HRA. No preparation is required before an HRA exam. During HRA, a provider uses a special microscope to look closely at the anal skin for HSIL and cancer. The provider takes a biopsy by removing a piece of skin the size of a sesame seed from abnormal-looking areas to check for HSIL or cancer. Volunteers were similar to the U.S. population of people with HIV, based on sex, gender identity, and racial and ethnic background. Over 4,000 people met the enrollment criteria, including having anal HSIL at screening. Half the study volunteers received treatment for anal HSIL, while the other half received active monitoring. HSIL treatment involves removing the abnormal skin with targeted electricity or heat, or rubbing medications on the HSIL to shrink it. All volunteers were examined carefully every 6 months. If cancer was found, the participant immediately stopped the study and was referred for cancer care. So what did ANCHOR find? During the 7-year study, 21 participants in the monitoring arm and 9 in the treatment arm developed anal cancer. Serious side effects were uncommon. The treatment arm showed a remarkable 57% decrease in progression from anal HSIL to anal cancer compared with those monitored without treatment. In other words, the ANCHOR study proved that anal HSIL treatment works to prevent anal cancer more than half the time. So to our study volunteers and community advisors, we say, hip hip hooray! By taking part in this historic study, our volunteers have helped many people avoid anal cancer. There is now a standard recommendation for anal cancer prevention, just like many other cancers. The Centers for Disease Control, or CDC, now recommends that people with HIV get screened for anal HSIL and anal cancer. The starting age for screening is different for men, women, and transgender persons. Screening includes an anal swab and a digital anorectal exam, where the provider inserts a gloved finger into the anus to feel for lumps. If a screening test is positive, HRA is recommended to check for anal HSIL or cancer. If anal HSIL is found, HSIL treatment is recommended to prevent anal cancer. Some people may also benefit from getting vaccinated against HPV, the virus that causes anal HSIL and cancer. So ask your provider about the HPV vaccine. If you are living with HIV, talk to your healthcare provider about the new recommendation for anal cancer screening and ask what anal HSIL screening looks like for you. Be sure to ask about covering your care costs. Talk to your healthcare provider immediately if you have any anal symptoms, such as itching, bleeding, pain, or any lumps or masses. For more information on anal HSIL, anal cancer screening, finding an HRA provider, or other research studies, visit anchorstudy.org or aidscancer.org. Give your butt the attention it deserves and help make anal cancer history.